This amniocentesis was performed in July 2007. It was filmed and published with the patient's consent. Amniocentesis is the process of taking a small amount of the amniotic fluid from around the developing fetus to allow it to be sent to a laboratory for testing. It's used to detect Down syndrome and other chromosome abnormalities. Amniocentesis is the most common diagnostic test performed when Down screening has yielded a high-risk result. Amniocentesis is an outpatient procedure carried out between 15 and 18 weeks of pregnancy. It takes about 30 minutes and no special preparation is necessary. Most of this time is spent being scanned and setting up the equipment. It takes only 30 seconds to obtain the sample of amniotic fluid. The amniotic fluid is sent to a laboratory for analysis and two separate tests performed, a chromosome test and a test for neural tube defects. The chromosome test is carried out on cells from the fetus present in the amniotic fluid. Preliminary results, including the sex of the fetus, are usually available 2 to 3 days after the test has been performed, and these are confirmed by cytoculture within 2 weeks. The spina bifida test measures the amount of protein in the amniotic fluid, and it takes about a week for the result to be made available. Amniocentesis is a safe procedure, but there is a small risk to the pregnancy, and about 1 in 100 women will miscarry after amniocentesis. If the fetus is shown to have an abnormality, you'll be told what the problem means and if treatment is available. You and your partner can then decide whether or not you wish to continue the pregnancy. In this video clip you can see the skin being cleaned with antiseptic solution, sprayed with ethyl chloride to numb it prior to the insertion of a very thin needle under direct ultrasound control. The sample is transferred to a pre-labelled bottle after checking the patient's identity details. Following the procedure, the fetal heartbeat is shown to the patient, who is then asked to sit in the waiting room for 5 minutes before going home. The result will be sent by first-class post if normal, and phoned to the patient if abnormal.